A big hello to all the health conscious viewers. This is Dr. Satish Babu, consultant urologist and andrologist from QNRI Hospital. First, I would like to extend my warm regards and greetings on the occasion of Men's Health Week, which we are celebrating on this June 10th. So, before going on to the celebrations, I would like to take the occasion to discuss an important health issue topic, which is of profound importance to all men. It is nothing but erectile dysfunction. So, how common it is to have erectile dysfunction in India? It was extensively studied in Indian population that 1 out of every 10 men suffer from erectile dysfunction, and it is increasing at the rate of 15% for the past 3-4 years. Compared to rural settings, urban people are having more of this problem increasingly. And coming to the age groups, it's very surprising to see that all age groups, it involves all age groups, starting from early 20s to late 60s. And when it involves these young people, it leads to unconsummated marriages, broken families, family disputes, etc. etc. Now, coming to the predisposing factors, the first predisposing factor I would say is the stress and the associated depression, which can be in their personal life or work life. So, when a person is severely stressed or depressed, he has got the wrong kind of signals going from his brain to the male organ. So, when these wrong neurotransmitters have a predominant effect, then the positive reinforcements are not there, and the patient will have erectile dysfunction. And second, I would say, is the preconceived notions, false preconceived notions, and also the performance anxiety. So, or people before getting married, they have fixed opinions based on the social media reports or peer talk about the this problem. So they tend to develop fixed notions, and when they are not up, when their performance is not up to that level, then they are severely depressed. So we have seen a recent media report where a newly married man committed suicide because of his performance anxiety. So it can be that severe. Then coming to other factors like lifestyle changes, lifestyle factors. Most important, I would say, is tobacco usage. So tobacco usage, what all can it do? It can, first thing is, it can cause negative effects on the blood vessels of the penile vasculature, and not only that, it can have detrimental effect on the smooth muscle tissue, which is supposed to respond during erection. So not only that, it can also cause disturbances in nitric oxide production, which is again important for penile smooth muscle vasculature expansion. So all these effects in together affects the man's potency. So apart from tobacco, the other important factor or addiction that can cause problems is heavy alcohol consumption. People who consume alcohol regularly in heavy amounts, they also have got chances of developing erectile dysfunction. And if it is prolonged, and the patient, if suppose he consumes alcohol over a period of time, it can even lead to testicular failure. And even recreational drugs, nowadays you are seeing increasingly people are using recreational drugs. They also can have very negative impact upon his or potency. Increasingly, we are also seeing young people who are very obese, and they develop what is called a metabolic syndrome. So these people have got negative hormonal profile. That is, the male hormone, the testosterone, is overwhelmed by the estrogen because of the fat in the body. The metabolic, their metabolism gets altered. So these people with metabolic syndrome also tend to have erectile dysfunction because of their negative hormonal profile. And coming to the other age groups, that is the middle age group and the later stages of life, predominantly the cause for their dysfunction, erectile dysfunction, is either diabetes or vasculopathy. We see that diabetes affects all parts of the male organ. It affects the blood vessels, it affects the smooth muscle, that is the cavernous smooth muscle, and also the nitric oxide production. So 30 to 65% of patients with diabetes tend to suffer from this disorder. And this disorder can range from like lack of desire to frank erectile dysfunction. So diabetes is a very important treatable condition which can cause ED. And we also see patients who have got vascular dysfunction. That is, the blood vessels are affected either because of hypertension or because of hypercholesteremia and other lipid disorders. So these people, they tend to have less blood flow to their male organ. So they tend to develop erectile dysfunction. Coming to other factors, there are other certain rare factors like people who consume psychiatric medications. These psychiatric medications, some of them produce severe erectile dysfunction because they affect the neurotransmitters. And also people who are on certain antihypertensives like thiazide diuretics, etc., etc., and also certain other medications. So these medications also can produce erectile dysfunction. Coming to the remedies and treatment of this disorder, the first important thing is a proper workup by a qualified urologist or andrologist who would assess the situation, and he would order certain investigations if at all they're required. And once the exact condition is diagnosed, the treatment becomes very easy. It has been estimated that up to 80% of patients with this disorder can be successfully treated. And the treatments, they involve very minor procedures, very simple treatments to very complicated procedures, like starting with pills, suggesting the patients to have pills, up to penile prosthesis. But it depends upon the patient's profile. So each patient requires a different kind of intervention. So because there is an explosion of treatment options on social media, many people are approaching quacks, unqualified people, or also resorting to self-medication. They see something on social media, they go and purchase the tablets, and then they start self-medicating. This is very dangerous. We have seen just a couple of days back where a young man lost his potency permanently because he used self-medication and the patient developed priapism, and after that priapism he permanently lost his erectile function. So he has been operated and he got a prosthesis. That's a different story. So resorting to self-medication and inadequate or faulty treatment by any unqualified person can lead to permanent disability. So if you consult a urologist or an andrologist on a regular basis, it's they after investigations and all, the treatment can be very simple. It can involve uh, treating them with a simple tablet, or stopping an offending medication. Sometimes treating gum infection, that also can produce erectile dysfunction. Periodontitis can produce gum infection. And finally, if the patient requires a complicated treatment, that even can be done. So I would call upon all the people to have awareness about this issue and to consult the urologist as and when required. So I thank you once again for a patient listening. Thank you very much. Bye.